What exactly is plastic surgery? What are its components and what does this specialty actually do for medicine? I will go into these topics in this video. Plastic surgery is not just aesthetics, but it's an exceptional branch among surgical specialties. Plastic surgery operates on almost all parts of the corpus, and the plastic surgeon is a doctor who solves a problem, which can be aesthetic or functional. The combination of aesthetics and function is the key solution to this specialty.
I'm Dr. Alavi and I hope you enjoyed this video.
The plastic surgeon.
When I started studying medicine, I asked myself, what does the term plastic surgery mean? At first, I thought this phrase is related to plastic. What does the word plastic mean? And what are the elements of this specialty? At that time, I was fascinated by this specialty, and it aroused my curiosity after I saw a case in the neurological clinic in which half of the patient's face was completely reconstructed because of a tumor that had grown in her face for years. The patient had covered the tumor under a veil, so that many of her acquaintances and friends didn't even see what was hidden under this disguise. This patient didn't really go to any doctor for a long time. I happened to see her in the operation room with no idea what had been done there. Since then, I made a decision to switch from neurosurgery, which was the first thing I planned to do, into plastic surgery. Plastic surgery is not just aesthetics. We have already defined that in many previous videos. But what exactly is this specialty, and what does it do? It's a very exceptional specialty compared to all other surgical specialties. In this specialty, operations are performed in all parts of the corpus, from the toe to the little finger, which means all areas of the body are accessible to the plastic surgeon. Therefore, the plastic surgeon is a doctor who solves a problem, which can be aesthetic or functional. The combination of aesthetics and function is the key solution to this specialty. Through this, plastic surgery can be based on 4 pillars, mainly restoration surgery as the primary pillar, then burn surgery as the second one, hand surgery as the third one, and the fourth pillar, that is aesthetics. Many of you know about the field of aesthetics through the media that shows many bizarre cases, but this specialty is much bigger than that. There are many cases in which the opinion of the plastic surgeon is extremely important because the surgeon takes many aspects of the surgical procedures into account. For example, I can tell you about a case in which a vascular prosthesis in an elderly patient had been closed, so that the leg had no longer blood supply and had to be amputated. Over weeks and months, we noticed circulatory disturbance in the hip and trunk area, and so that there are not enough active tissues supplied with blood. This is where the important role of plastic surgery comes into play, because the goal here is the reconstruction of the tissues. This actually means looking at what we can achieve so that the patient had a stable condition in his trunk area, where prosthesis can be placed. In this case, there were many options like free tissues transplants, which is performed like transferring organs from other areas of the body by its vessels. And these pieces of tissues that are supplied by a vessel may even have a nerve supply, so that these vessels and these nerves are transferred to the targeted area. It's known about plastic surgery that it restores the face in a complex manner, and many of you are certainly familiar with the reports on facial reconstruction that have been done in the USA and in other parts of the world. These are the first reports on plastic operation at the highest level, because they combine the microsurgery and the reconstructive surgery, taking into account functional and aesthetical factors. Burn surgery plays an important role in addition to its role in transferring tissues in the field of reconstructive surgery and microsurgery. For example, one of its most important roles is in the field of the skin burns that can be ranged from the smallest scaled to severely burned ones, which are treated in the intensive care units here in Germany. Quality of the primary care is an enormous role, but also the correction in the following months and years because of the appearance of scars and functional failure, and that is a huge part of the plastic surgery. For example, a few months ago, we had a case of a 5-year-old boy who developed scars between his finger after he scalded his hand. These scars were very severe and restricted the mobility of the fingers a lot, so that the surgical measures were necessary. The achieved results were really unbelievable because the mobility of the hands were completely restored. We have to consider the importance of this specialty, especially at the level of individuals, when the operation are able to restore the function, and not only the function, but the aesthetic form as well. Therefore, this specialty offers aspects that almost no other medical specialization does, and it's a complex specialty and we find it present in every part of the body. Then of course comes the specialty of hand surgery. In this specialty, all areas of fraction repairs are included, in addition to nerve compression syndromes and congenital malformation in young children, but also tumors and changes in the soft tissues of the hand. The hand is a very complex organ. Many hand injuries that happen at work are treated with hand surgery and plastic surgery. Last but not least, aesthetic surgery. This specialty is really an art to achieve amazing results, and there is a special feature in aesthetic surgery that we perform operation on completely healthy patient who may not look so bad or have such a poor characteristic, but the aesthetic surgery must offer so much optimization that the patient is satisfied with the results and the surgeon as well. You understand how complex aesthetic surgery and medicine are, because even the smallest mistake may lead to major complication, which may be permanent and may not be returned as they were. Accordingly, aesthetic surgery is a sub-area of surgery that requires the highest level of precision and must achieve the best results. Aesthetic surgery extends from breast augmentation to breast reduction, tummy tuck, body sculpting, Botox injection, facelift, and lip lift. Here we must think that the surgical work can be done in all parts of the corpus, from genital area to skin tightening all over the body, in addition to liposuction. Sometimes we find that the aesthetic surgical work is a work with functional dimensions as well as its aesthetic dimensions, and here we have filmed some videos of genital surgery. We can say that the surgical work is not only cosmetic but also has a functional meaning. And since many aesthetic surgeries are not funded by health insurance, this doesn't mean that these surgeries don't have a functional aspect. In general, we mustn't forget that many aesthetic surgeries also have functional aspects that are not funded by health insurance because of laws and rules. This means many patients have to reconcile for years with their situation, and this often leads to other problems. For example, large breasts lead to a bad posture and causes secondary damage, which means that the function of plastic surgery is to look carefully and early to confront a problem to prevent secondary problems. Here you can see the number of viewers who watched the video and haven't yet subscribed to the channel. So subscribe to the channel and don't forget to like, because you support our channel and also support the production of this difficult video behind the scene. Our goal in this video is to reach the largest number of people so that all sections of plastic surgery are explained, to avoid many complications and lack of knowledge. And thus we will be prepared for all interventions from you or one of your friends. So subscribe to the channel and support it. Share the videos with friends. We hope that you will be with us in the next video. Your Dr. Alavi.